Greetings, New Zealand naturopath Eric Backer, author of Candida Crusher and formulator of CanXida, the Candida dietary supplements that seem to be hitting the right spot with many people around the world now. In about 70 different countries enjoying the amazing results they're getting with my CanXida product. This is another case history, and this is quite a mind-blowing case history. This is a 63-year-old lady called Jean, who I've seen. Now, Jean is one of these medical disasters. Okay, this is the Titanic of the ladies with irritable bowel syndrome. All right, this was a disaster in the making, and a disaster waiting to happen, and it's a terrible, tragic case. It should have been completely avoided. This woman is just another absolute complete botch up of the medical profession. Now, I'm not bagging all doctors, because I've got a lot of medical doctor and specialist friends who are fantastic people doing amazing jobs. But there are plenty of medical doctors out there that do terrible jobs, right? You'll see good and bad in all professions. I mean, I've seen terrible naturopaths and good naturopaths. I've seen terrible chiropractors. So these case histories are not meant to be bagging sessions for medical practitioners. But this case here is one where everything went wrong for this poor woman, and it basically ruined her life until we started to really set things right. Okay, so I'm going to read a bit out of my book, as I usually do with some of these cases, and I'll give some narration along the way, all right? So Jean saw me a while ago now and came from England to settle down in New Zealand. When this patient first came in, what struck me was how thick her filed hospital note was from London. It was literally 3 inches thick of notes. This patient had been suffering with multiple digestive complaints for over 40 years, including cramping, bloating, nausea, and continual diarrhea up to 10 bowel motions per day. Her main problem was her increasing intolerance to foods, and Jean's diet had become so incredibly restrictive that she could only eat a few foods, including chicken, fish, spinach, and beans, and that was it. Fresh green beans. Most foods would set off terrible stomach pains she was experiencing, which caused her to eat less and less. Jean was one of those patients who ticked every condition box on my case-taking form. She had headaches, insomnia, migraines, arthritis, anxiety, depression, urinary tract infections. In fact, Jean had everything. This patient had been to over 25 doctors, several specialists, including bowel specialists, not including herbalists, naturopaths, physiotherapists, osteopaths, and even more. The main concern was Jean's weight. It had dropped to less than 80 pounds, okay, 39 kilos. And at 5'6" in height, it's pretty bad. A woman that tall, literally looking like something that had come out of one of these concentration camps, with the liberation. It's quite terrible to see a patient like that in my room, to see, you can see the bone everywhere. So, and of course, what her bowel specialist in England said, he told her that she needed to put on more weight. So he told her to eat more potato chips and more chocolate to gain weight, which is why he's a bowel specialist. More like an idiot, as far as I'm concerned. If you tell someone with a bowel problem to eat lots of chocolate and crisps, it's a stupid thing to do, isn't it? So what tests were performed on Jean? Apart from the usual blood tests, this poor woman had over a dozen colonoscopies performed, and each time all was normal. The last visit this patient had to the gastroenterologist. Our findings indicate that Mrs. X has no significant disease. No other tests were ever performed. No stool tests, no allergy tests, just bowel examinations and the odd endoscopy. So that's a camera down the throat. So camera up the backside, camera down the throat. They couldn't find anything. So what do I do with cases like Jean? Whenever I see these patients, I usually do a comprehensive digestive stool analysis ×3. So it's the best stool test you can do. And guess what we found? We found multiple issues, as can be expected, but in this particular case we found a level 3 of Candida in all stool samples. So this woman had 3+, which is a lot of yeast which could be cultured in each stool sample. This is one of the worst bowel cases I've ever seen involving a yeast infection. There was a significant finding for the patient, and the first time we had answers, and the patient and her husband were absolutely delighted, but also equally annoyed that it took 40 years to find the answers. So how the hell did Jean end up like this? How did she end up like this wreck of a patient? Well, I'll explain to you further. Listen to this. The answer is quite simple. It's through the medical system. When Jean was 18 years of age, she suffered from a terrible sore throat, so her doctor gave her penicillin. After 3 weeks, the throat was still painful, so more antibiotics were prescribed, and then more and more and more. Jean developed a bowel problem back in the late 1950s, when nobody understood the significance of repopulating the bowel with friendly bacteria. And so the patient suffered, on and on. Her recovery took 9 months, which is a lot quicker than I thought it would take. But it was mainly due to her following all the suggestions that she improved so quick. This case could have taken 5 years to recover, but she short-tracked it because she really wanted to get well. So she followed the necessary lifestyle recommendations, like relaxation, deep breathing, Tai Chi, and supplementation, and adhering strictly to the Candida crusher diet principles. Jean now weighs 61 kilos, which is 122 pounds, and has 1 normal bowel motion per day. Okay, so can you relate to Jean? Maybe you know an aunt or a grandmother or a sister or a relation who's like Jean. She's been sick all her life. She's a medical disaster. She's become a social leper. She's basically avoided by a lot of people because all she does is moan about her health all the time. There's a lot of patients out there. It's really sad, and sometimes they even take their own lives because nobody will listen to them or give them any solutions. Ask yourself this question. If you know someone like this and they started off taking antibiotics a long time ago, they could be another Jean. It's very important for these people to follow the correct principles that I've outlined in the Candida Crusher program. And as you can see, even after 40 years, you can still get recovery. We can still give this lovely lady some quality of life back for the next 10 or 20 years of her life. And this is the thing about my profession I love the most, is we're helping people. We're helping people to get well, So think about how you can avoid getting in this situation yourself. If you're young, take heed. Don't take antibiotics at a young age for every little sniffle or cough or cold you get. Look at natural treatments. If you have developed a fungal infection, look at natural alternatives for that. I developed the CanXida range of products for this. The first product I developed is called CanXida Remove, CanXida. I didn't have it when I had Jean as a patient, so I had to use a hodgepodge of all sorts of supplements. But if I had Jean again, I'd put her on CanXida Remove, start her on 1 tablet a day, build her up to 3 a day for about a month, and then take her up to 6 a day. And I'm getting outstanding results with this product with patients like Jean right now. So the moral of the story, avoid antibiotics as much as you can. If you do have a bowel problem, get it sorted sooner rather than later. Consider stool testing. Stool testing will show you where the problems are, and then they can be treated by dietary and natural means rather than pharmaceutical drugs. Thanks for tuning into my video. I appreciate it.